I'm going to kick it over to Dr. Ken Ramos. He's a physician scientist, for those of you who don't know him, a longtime friend, mentor, and collaborator of mine, and a key thought leader in several fields, including toxicology, genomics, and genomic medicine. And let him take it home for us. Ken, all yours.
All right, thank you. Fantastic panel discussion that you just had. This summit has truly been spectacular with an introduction by the All of Us research program, highlighting some important aspects of this key national initiative in building new models for robust and diverse ecosystems. I think one of the important lessons to take out of this particular activity that we've had today is the transition from precision medicine and the idea of individualized approaches to healthcare, as important as that is, and take important lessons into precision health, in which we begin to take some of the important lessons of precision medicine and put them at the population level, which of course is going to be what requires actionability on the part of the entire ecosystem. The All of Us research program has created infrastructure that I think will be here for quite a while. And importantly, I think creating an ecosystem that, of course, allows for advantaging, all of the technology that's available to us. I think, the fantastic support and vision that Genentech has shared with us, I think in creating, the momentum for this particular initiative is going to be extremely critical in continuing to change the landscape of healthcare, and obviously making a difference in the way in which that care is provided and the impacts that I think can come from precision approaches and in their integration into healthcare. I was really impressed by the quote that was provided by the Genentech, presentation, focusing on the Mae Jemison quote on the future, just doesn't happen, but it actually is created. And I think that's in fact what we're trying to do in this series of summits sponsored by Genentech. Of course, we generated a great deal of important information and exchange in our panel technology of innovation tools with contributions by Burst IQ, Oracle, and Merck, key leaders and key thought leaders in this particular space. In the context of the Merck presentation, I think the focus on low-income countries and the globalization of precision healthcare approaches is going to be extremely critical as we continue to move into the future. And of course, an important aspect of this is the need for inclusiveness and for us to be able to embrace social, environmental, and lifestyle determinants of health as important contributors to health outcomes. The whole idea brought forth by Oracle, taking advantage of the huge infrastructure created by Cerner on the idea of a digital footprint and digital DNA, I think is going to be something that we're going to have to keep in mind as we continue to plow forward. And then last but not least, of course, the excellent contributions made by Burst IQ in their statements regarding infrastructure development, evolution of clinical trials, and our ability to take on some of that data. And of course, the real power that comes from integration of data sources and data analytics, I think is going to be extremely critical as we continue to move forward in this particular space. I think it's important to keep in mind that we need to focus on alignment of stakeholders, because it's this alignment that's going to break down silos, and it's going to enable us to truly build a collaborative that's going to be able to advance the field in ways that we need to achieve. I think the integration of systems that's going to be afforded by technology is going to be extremely critical in us being able to mine and utilize real-world data and real-world evidence, as we continue to march forward. I think we were left with very important statements about the vision for the future, with a huge emphasis on, patient and stakeholder engagement, accessibility of technology, and ease of use, and of course, a focus on health equity, recognizing that it's critical that everybody benefits from these technological advances. I would like to close by giving you a call to action. All of you who participated in this particular, summit, recognizing that each one of us, has something to contribute, and please partake in future activities that the Texas A&M Health Program is going to be able to offer. As next steps, we plan to have a follow-up, summit that will actually begin to integrate some of our clinical partners into this important cause. The last thing I'd like to close with is a big thank you to Genentech, to Merck, and to Oracle for their vision, for their support, and for their ability to contribute to this activity today. Last but not least, a big thank you to Health Tech Austin for their support throughout this important journey. And with this, please stay put and look forward to future activities being announced by the program. Thank you.